So in our previous video, we talked about how in the innate immune system, in acute inflammation, you produce a bunch of proteins, produce cytokines that draw in cells, right? How do those cells leave the blood and get to the tissue? That's going to be the talk of this video. So immune cells leaving the blood vessels. They usually leave via the post-capillary venules, veins and not arteries because veins are thinner, and then post-capillary, around the capillary just because blood flow is slower. That's going to be a running theme. You want slow blood flow. It gives the cells, immune cells, a chance to leave. Right? How does it leave the blood vessel? Well, the first step is going to be margination. Margination. And margination is when your immune cells will move to the outside, the margin. That's why I call it margination. And it's helped by vasodilation. When the blood vessels dilate, it seems like that slows the blood a little bit. Slows the blood a little bit, decreases the pressure. The cells aren't forced through. They can kind of move to the edges, move to the margins. All right. The second step is going to be rolling. Once the cells are at the edge, they will want to bind a little bit to the wall. Just a little bit, just enough to kind of slow them down, kind of step on the brakes, slow them down. And we call that rolling. So instead of flying through the blood vessels, they hit and bind and they kind of roll and slow down on the blood vessels. And the thing that binds and slows things down is going to be your selectin. You can think of S for selectin, S for slow. Slows down your leukocytes, your immune cells. So your selectins. All right, your leukocytes have something called L-selectin. Think of L for leukocytes. Okay. So let's just draw it. It might have this L-selectin that binds to the selectin of your endothelial cell. Your endothelial cell have E-selectin. Think E for endothelial. And this is not usually expressed unless there's inflammation, right? I mean, your cells shouldn't leave unless there's inflammation. So it will express E-selectin. So this is E. This is L. It can also express P-selectin. And P-selectin is held in your Weibel-Palade bodies of your endothelial cells. So it contains some P-selectin that can also help it bind. Right? That's an important one you should know. P-selectin is also found in your alpha granules of your platelets, but that's not what we're going to talk about today. So your selectins will slightly bind and slow your cells down. Slow your cells down. Now, something you should know, if you're deficient in this, then you can't move your leukocytes. You can't slow it down. You can't leave the blood vessel. And so you get what we call type 2 adhesion deficiency. You cannot adhere to the vessel. You can't leave the vessel. All right. So that's step 2. Step 3 is going to be adhesion. Now that you slowed down enough, you want to fully adhere and come to a complete stop. And the way you come to a complete stop is you have to bind something very, very tightly. So here your leukocytes have something called integrin. Integrin. So this would be an I for integrin. And it will bind to something on your endothelium called ICAM or VECAM. ICAM or VECAM. And when it binds to that, it comes to a complete stop. Comes to a complete stop. So complete stop. If you're deficient in integrin, so right, deficiency, cannot bind, cannot leave, we call this type 1 adhesion deficiency. If your neutrophils cannot bind, cannot leave, then they will stay in your blood. So you have increased neutrophils in your blood, but none in your tissue. They can't leave and get to your tissue, right? None in tissue. And how that shows up, you'll have no pus, because neutrophils make up pus. They die and they make pus. So you get all these sores, but you have no pus. That's a sign. But the first sign is delayed umbilical cord separation. That's the one they always ask. Why is that? Well, when you're a baby and you're delivered, you have your umbilical cord, and your neutrophils will go and chomp on your umbilical cord until it falls off. If your neutrophils can't leave the blood vessels, can't get to your tissue, can't get to your umbilical cord, then it's not going to chomp on it, not going to fall off. So you're going to have an umbilical cord just staying on for days and days and days. You get delayed umbilical cord separation. Now, can you think of how they might ask that? A baby's born, delayed umbilical cord separation. What's the mechanism? Deficiency in integrin. Or what's it called? Type 1 adhesion deficiency. All right. Or what step is disrupted? The adhesion step, coming to a full stop. All right, coming to a full stop. The fourth step is Diapedesis, which means to leap through. Here it will travel through. Now that it's come to a complete stop, it will travel through your endothelial cells and leave the blood vessel. Travels through and exits by binding to VECAM. Binding to VECAM. And then it will migrate where it needs to go. And that is how your immune cells leave your blood vessels. You gotta know this code. They like to ask this when it comes to immunology. Now, after it's left your blood vessels, then it will go to where the bacteria is. Right? Go to where the bacteria is. And your immune cells can do multiple things. But one of the things it can do is called respiratory bursts. Respiratory bursts. Where it uses oxygen to make free radicals, and that damages and destroys pathogens. We call these reactive oxygen species. Right? And the first step is taking oxygen and converting it into O2 free radical, or sometimes called superoxide, via the enzyme NADPH oxidase. I just drop a few letters, it's just called the Neal-Patrick-Harris oxidase. That always helps me remember it. So the NADPH oxidase, or the Neal-Patrick-Harris oxidase, will turn oxygen into superoxide. And superoxide can get converted by superoxide dismutase to make H2O2, also known as hydrogen peroxide. Doesn't hydrogen peroxide kill a bunch of bugs? You can buy that over the counter, pour it over your wounds. It kills bacteria. All right. Hydrogen peroxide can get worked on by myeloperoxidase, which is green and gives sputum this green color. So if you're sick and you're revving up this cycle, you make a lot of myeloperoxidase, you get this green sputum, right? And it turns hydrogen peroxide into HOCl, better known as bleach, the strongest thing we have. Bleach kills everything. Everything. It's also known as hypochlorite. So they might not say bleach on your test, unfortunately, because bleach is a trademark name. So they might say hypochlorite, means the same thing. Now, hydrogen peroxide can take many different routes. The one we care about, because we're talking about immunology, is this bleach route, but it can react with iron and via the Fenton reaction and make OH negative, which is a free radical. That's why too much iron can be damaging. Via the Fenton reaction, you can make free radicals. Hydrogen peroxide can get worked on by catalase, seen in bacteria, to make water. So it kind of neutralizes the system, helps it survive. Bacteria with catalase can neutralize the system and help survive this system. And lastly, our body has a way to neutralize this. I mean, we can't just have hydrogen peroxide all the time, just all over our body, right? Sooner or later, we have to neutralize it. And we turn it into water. We do this by turning reduced glutathione into oxidized glutathione via an enzyme glutathione peroxidase. And this needs selenium, you gotta know this. All right. And our body says, well, let's recycle this, right? This is important. We want to be able to neutralize any excess hydrogen peroxide. So let's recycle it and make sure we have enough for the next time. And the way we recycle it is by turning NADPH to NADP plus via the HMP shunt. That's a biochem throwback. Watch my biochem videos if you want to know what the HMP shunt does. So this helps recycle it via the enzyme glutathione reductase. And this needs riboflavin. So you gotta know the cofactors too. So that turns oxidized glutathione and reduces it to reduced glutathione. You kind of recycle this pattern and you can neutralize any excess hydrogen peroxide. So NADPH not only makes free radicals, but it also helps neutralize it. That is your respiratory burst. Hope that's not too bad. One pathology that shows up on your respiratory burst that you need to know is what happens if you're deficient in this? Well, if you're deficient in this, you get something called chronic granulomatous disease. So when you're deficient in Neopatrick Harris oxidase, you can't make superoxide, you can't make hydrogen peroxide, and that's really important because we need that to make bleach and to destroy cells. Right? The good thing is some cells, some bacteria will make hydrogen peroxide just as a byproduct. And we can say, hey, that's awesome. We can use that to make bleach and destroy you via our respiratory burst, right? So some cells help us out, kind of bypass this deficiency, bypass this roadblock. Some cells will make hydrogen peroxide, but at the same time, they have catalase to neutralize that hydrogen peroxide. Those are dangerous. Those are dangerous. If it neutralizes this and we can't make this, then these bacteria have free reign over our tissue, So catalase positive bacteria are very, very dangerous if you have chronic granulomatous disease. What are some catalase positive? Staph is a big one. So you get recurrent staph infection. There are a lot more catalase positive bugs. I'll make a list in my notes. Most people remember staph, and the step realized that, so they rarely ask staph anymore. They'll ask some other catalase positive bugs. So just make sure you know at least 2 or 3. And that is chronic granulomatous disease. Now, how do you diagnose it? Well, in the history, they'll talk about someone with recurrent staph infections, but a lot of things can cause recurrent staph infections. So how do you diagnose it? You can use something called the dihydrohodamine flow, where you coat all your cells with dihydrohodamine, and that stains it. And normally, when you have respiratory bursts, you will make superoxide, and that turns your cells green when you have the stain. Well, if you can't make that, then you have decreased green fluorescence, right? Makes sense. You can also get the nitro blue test, and this is working on a similar principle. In normal cells, you make superoxide, and this will turn the solution blue. Well, in these cells, if you can't make this, then the solution doesn't turn blue. So that is your respiratory burst. We talked about how your white blood cells leave your vessels. Now how they destroy bacteria. Those are your white blood cells, right? And you might be saying, well, can we talk a little bit more specifically about innate cells. Can we talk a little bit more specifically about macrophages, about natural killer cells? Let's do that. So let's just talk about innate immune system cells, like your natural killer cells, like your macrophages. Your macrophages, you might have remember from like high school biology, your macrophages get its name because they're things that phagocytose things. They're called big eaters. They like to eat things. So they phagocytose. So they will engulf things and eat things. They can also make a lysosome and fuse it with that bacteria. We call this a phagolysosome. And you know lysosomes have a lot of things that can break stuff down. So when it fuses with this bacteria, your lysosomes will break down that bacteria. You digest it. All is well. We said that phagocytosis is facilitated by opsonins. Can you name a few opsonins? Say complements, IgG, all that stuff. You're on the right track. And then lastly, what do your macrophages do? They are antigen presenter cells with your B cells. Remember that? Your macrophages can also release cytokines. They can release IL-1, and that induces fever. IL-6, which increases acute phase proteins. Pause the video. Tell me, name all the acute phase proteins that we talked about. How about that? That's a good one. Acute phase proteins. So I'll give you a second. IL-8, what does that do? If you say chemotactically pulls in cells, you're absolutely right. Now pause the video. Tell me all the other products that pulls in cells. Immunology is a tough one, especially when it comes to cytokines. So that's why I'm making sure we're doing a lot of these mental exercises. And I hope you do it at home because that's how you get a better score. So pause the video, tell me all the things that we talked about that pulls in cells, chemotactically pulls in cells. Hopefully you said things like LTB for kallikrein and all that stuff. IL-12, which induces TH1. Why does it induce TH1? Doesn't TH1 increase interferon gamma, which increases macrophages? So it's kind of like a cyclic pattern, right? The more macrophages you make, the more it creates IL-12, which makes more TH1, which makes more macrophages and kind of keeps the cycle going. Then lastly, TNF alpha, which causes granulomas. All right. IFN gamma and TNF alpha causes granulomas, and you got to know that. Granulomas are just kind of like the gravestone of macrophages, dead macrophages. So this induces macrophages, right? And then this kind of continues macrophage inflammation until they basically die and create granulomas. And that's how you make your granulomas. TNF alpha also is important because it's seen in cachexia patients. So people with cancer, they get very cachexic. TNF alpha. That's your macrophages. Let's talk about your natural killer cells. Your natural killer cells are named this because they are born to destroy cells. They're born to destroy cells. And they actually come from a lymphocyte origin. Share origin with your T cells. And they actually have CD markers on them. Yeah, kind of like your T cells. CD16, CD56 are the ones you need to know cold. Now CD16 can bind to Ig, immunoglobulins, and kill that cell. We call this antibody-dependent cytotoxicity. Holy moly, what a great name. Kind of gives it away, right? Or it can kill cells that don't have MHC1. They've seen all cells. So if your natural killer sees something that doesn't have this, it knows something's up, right? And it really likes viruses or viral infected cells and tumor cells. How does it kill these cells? It has the perforin and the granzyme mechanism, which is also seen in your CD8. Perforin is a pore-forming protein. All right, perforin. Perforin for perforate. So it perforates the bacterial cell or the viral cell or the tumor cell, whatever. And then granzyme will enter and cause apoptosis. It's like a 1-2 punch. It's like a 1-2 punch. All right, that does it for all the cells of your innate system. We talked about how your cells will leave your blood system, how to destroy things. Hope you enjoyed the video. Thanks.